Good morning. My name is Stephen Williams, the Director of Houston Health Department, and welcome to the COVID-19 update. I have with me our two top docs from Harris County and the City of Houston. With us from Harris County is Dr. Umair Shah. With us from the City of Houston is Dr. David Persse. We have a number of questions that are coming in today, and we're going to jump right into it because we're actually having two segments. The first segment will actually be with our two docs, and then we're going to bring in some experts on aging for the second segment. Are the heat maps accurate?
So the data that contributes to the heat maps is accurate, but you have to be careful how you interpret them because it's only as accurate as the data that's fed in, which is largely based on the testing. And since I don't think any of us feel that we have an adequate amount of testing going on, the results I think need to be taken with a grain of salt. In particular, the areas where they show a high density of cases is probably accurate, but in the areas that show low density, it may be because there's just less testing or the people who live there didn't get tested, they didn't travel to the testing site. So like any other piece of data, it needs to be taken in context.
Yeah, I agree. The only thing I would just add to that is that with the pandemic, by default, you would assume that everywhere in a community, when you have community spread, et cetera, you're going to have cases, you're going to have transmission, and so that's why we don't want anybody to be thinking just because their part of a map is light colored that they should also not be taking the social distancing and all the other practices and guidelines that we're putting in, we're telling people and we're asking people to help us with, that they're not taking that lightly.
There was a lot of hype about increasing the capacity at the testing sites. How has that worked out?
Well, we with the City of Houston, we had a couple of struggles with that because we actually had a number of things change at the same time. So in the previous weeks, we had been using staff from our local hospitals that had contributed nurses to staff the lanes, as we call it, as the cars come through each of those lanes. And we need to get those folks back into the hospital. So we had made a request to the state, and they sent us some personnel, and they're members of the Texas military forces. And the folks who were here initially were administrative folks, and so then they wanted to swap those out for people with some medical training. And so those folks, when they came in, they didn't understand necessarily exactly how things were set up. And so we had to train them. And at the same time, the federal government switched over from the swabs that somebody puts in your nose to the ones where the people put in their nose themselves. And at the same time, we went from the 250 limit to the 500 limit. And because a lot of things changed at once, we haven't gotten up to the 500 as quickly as we wanted.
Yeah,
but we will.
Yeah, and I think we're in a situation as well that we've just made the change, so we know that there are people in the community that want testing, and obviously going to a readyharris.org tool to be able to do the online screening. But I think it's really key to what Dr. Persse is mentioning is that, look, we've got capacity, we want people to be tested as part of that, but also reminding people that it's, at least in our site, it's for those who have symptoms. I know the city is doing anybody with, even including without symptoms. The key message is it's free of charge. So if you want to get tested, need to get tested, please avail yourselves of those opportunities.
The other thing I want to take this opportunity to talk about is that with the self-swabbing, instead of having somebody else put the swab up into your nose, you do it yourself. And when you watch the video, it's pretty easy. And so for the folks that are watching from home, you put the Q-tip, and it's about the size of a regular Q-tip, and you put it in one nostril, you turn it one full time, and you let it sit there for 15 seconds, which takes a little bit of time. You take it out, you put it in the other nostril, turn it a full turn, wait 15 seconds, and that's it. It should be done in less than a minute. But apparently the public didn't anticipate that. They had to be talked through it, and it wound up taking much longer than we had anticipated. So that slowed down the lines too. So if you're watching from home, it's as simple as putting a Q-tip only halfway up your nose, turning it, letting it sit for 15 seconds, doing the same thing the other side.
Yeah, one message I wanted to say is that, and I don't know how it is at the city, but right now it's about half an hour it takes for people to come in and out. So I don't want people to be thinking of those images that we had previously where it was like 3 hours or 2 hours or a long extended period of time. So again, if you want to get tested, avail yourselves of these opportunities. They're free of charge. We're working through all these issues and challenges that we have, but we're confident that we can really serve our community. We just want to make sure that people are aware of them.
So it seems like what you're saying, really, if people have the understanding of how to do the self-testing and show up at one of the sites, they can be in and out in less than an hour.
Should be, yeah.
At least ours, yeah.
Okay. Harvard epidemiologist Mark Lipstick predicts that the likely outcome is that coronavirus will ultimately not be containable, even with strict control over movement and early identification. In China, the virus has spread over much of the world. What's your response to that?
That's a tough one, I'll tell you. I mean, you know, again, we've said this so many times. This is like the most studied virus in the world, and also all the activities to contain it or slow it down is also the most studied virus in the world in terms of those response capabilities. I think the news is that it's too early to tell. We are hopeful that he is wrong, though, that we can contain this, we can do whatever we can to limit the spread, but obviously time will tell.
Yeah, you're right. It's the most studied, and yet we feel like we know the least about it at the same time. So I hope he's wrong, but we're acting as if he's right. That's our job, is to lean forward and act as if he's right, but we hope he's wrong.
Yeah. So we should never become complacent.
No, never become complacent.
Well, even after this whole change in our society, we're really going to be thinking about ways that we're going to still need to be thinking about social distancing and washing our hands and even wearing masks and things of that nature. Our life has changed as we know it.
Okay, thank you for joining us for the COVID-19 update with our two top docs. We'll be back in just a few minutes. To our COVID-19 pandemic update. When you drive past some neighborhoods, as shocking as it may seem, it looks as though the word about social distancing has not been received. What are we doing about communicating with residents who are not watching media alerts?
We're doing everything we can. You know, all of our champions in the communities, you know, faith-based and incredible number of leaders, and we want to thank them for everything they've done. Our social media, get the word out, obviously doing everything we can to get it from these kinds of activities. But I'll tell you, it's a huge community, and we know that there are places where people are heeding the guidance better than other places. We're hoping that we can shore that up so everybody understands that it's all of us in this. The success of our community ultimately is about all of us working together to fight this virus.
Yeah, I can't believe there's anybody who doesn't know about the recommendations. Some people are choosing not to follow them, but I can't believe there's anybody who doesn't know. So we've done a good job getting the word out. Now it's, you know, convincing people of the importance of it, which is the second step, and that will be an ongoing challenge.
Okay, this is a good follow-up to that, I think. Can we ever expect that social isolation and closing the economy will really work, or are we better off opening it up, keeping our old, infirm citizens isolated as much as possible, and let the virus work its way through the population, which would help build up immunities until we develop a vaccine? I actually started to comment on that myself. Maybe the cure is worse than the disease.
Yeah.
Well, you know, early on there were questions about this, and obviously decisions that we've made to do everything we can to slow this virus down, I think has been, at least thus far, working in our community. We also recognize that we're not the United States of Harris County or United States of Houston, or the United States of America, and a lot of what happens around the global and the national and state context impacts us locally. I do think there are going to be some real serious discussions, though, behind the scenes about what are strategies when we reopen and how do we really help those who we're most concerned about, obviously those that are seniors and those who have underlying medical conditions. That's where we're really going to be focusing as well, but we do need to be worried about how those strategies are going to be in the face of reopening our communities.
Yeah. So, you know, I had a pretty spirited conversation with somebody recently, basically to this exact point. And a couple of the comments that came to my mind while we were having this conversation is that there's really, it's impossible, I think, in spite of our current efforts, we still find elder folks in nursing homes and even at their own homes who are becoming infected. And we know that because tragically they're making the predominance of the people who are dying. So I don't know that we could have a society that is more open than we currently have and yet simultaneously do a better job at protecting the elders. Mm-hmm. The other equation, part of that equation, that conversation, is that there are younger people who are becoming critically ill and winding up intubated and in the ICU for weeks on end, mm-hmm. and some of them are dying. So, you know, the idea of just letting it burn through the society is not something that comes without a huge consequence to it. Mm-hmm. I think our answer really is we need to figure out how to manage society in a way that until we can get to a safe and effective vaccine.
That's right.
The question has come in about testing. Can you discuss testing? What tests are coming online? Can you explain the differences between DNA versus antibody testing? That's just two of the three questions, but go ahead.
I'll take that one because that's one of my favorite areas. And so it's actually an RNA test. Mm-hmm. That looks to see if your body, if the virus is, and of course we're testing your nasopharynx, if the virus is there, meaning that your body is actively reproducing new viral particles, meaning that you are acutely infected and that you are therefore potentially contagious to somebody else. Mm-hmm. The antibody test is a test looking for your body's immune system. And so there are things called immunoglobulins which will be detected in your blood. So the viral test is in your nose, the blood test is for the antibodies. But here's the thing about it. First of all, the antibody test, the ones that are out there now, have a pretty wide range of false negative rates. So that's of concern. And we're still trying to narrow down what their false positive rate is, so you can get a misleading answer. Secondarily, is that we've already found cases where people are still shedding virus and they have immunoglobulins. So their body is responding, yet just because you have immunoglobulins doesn't mean you're not shedding virus. So it's far more complicated than just the two tests, far more complicated than the salespeople would let you believe.
Mm-hmm. The other thing is that now there's also talk about saliva testing.
And that's right.
And so there's other modalities, and there's point of care testing, which is similar to that RNA testing, but it's really, again, to get it quicker. But I think Dr. Persse absolutely nails this completely on what we're trying to do is to keep up with all these moving technologies, even in the testing and laboratory component of this. And that's making it very difficult for not just for all of us to handle, but also then communicating it to our community members.
So could you talk a little bit about the testing environment? Exactly who's testing? I know there are 4 government-sponsored sites, mm-hmm. but who else is testing in the community?
Yeah, so we've got a couple of remote sites as well that we're doing throughout the county, as well as our 2 sites. But there are private sector. You can still contact your healthcare provider, your doctor. There are hospitals and healthcare entities doing it, clinics that are doing it. But you're also having some nonprofits and other organizations that are out there that are testing. And so I think there's a lot out there. We just want to make sure whoever somebody goes to is somebody you trust. There's a credibility to what they're providing.
Right. And one of the other things is how quickly you can get your test results.
That's right. Yeah.
So what can we expect in the next week?
Well, I think you're going to expect more of this. I think you're going to see, people wear their masks. You're going to see continued social distancing. You're going to see testing that's going to increase. You're going to start to see really a lot of this real conversation around what does reopening look like. And there's a lot of this that's going to be happening in the next week or so. Again, we're getting closer to that April 30th timeline. Mm-hmm. So, we are going to be having those discussions.
Yeah. Okay, go ahead.
I think that in the conversation of reopening, one of the important things is we've got to have better testing capacity, because we're going to need to move back to where we would have liked to have been when this all started. If you can identify a case, you stop the virus there. You identify another case, you stop the virus there. In order to do that, we're going to have lots of testing and a public health army, the likes of which we've never seen before.
Oh. I want to thank our 2 public health docs for participating in the first half of our COVID-19 update. Please stay tuned for the second half, where we're going to bring in some aging experts.
wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing the song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1.
Taking care of yourself is also taking care of others. We're all in this together.
How does the 2020 census affect representation? There are 435 seats in the House of Representatives. These get distributed to the 50 states by population, and an accurate census response helps your state get the right amount of seats. States with smaller populations get at least one, while states with larger populations might get more. Shape your future. Start here. Visit 2020census.gov.
Well, welcome back to our COVID-19 pandemic update. This is a second part of our update. I forgot to mention earlier that this COVID-19 update is actually sponsored by the Rotary Club of Houston. I want to express my gratitude to President Kathy Finninger, who was gracious enough to provide us a number of questions from Rotary Club members and other folks. The second half we have Dr. Lindsay Botsford, primary care physician with Iora Primary Care. Welcome, Dr. Botsford. And Paula Johnson, the bureau chief for the Harris County Area Agency on Aging. I'm going to start with Paula. Give me a brief overview of the Area Agency on Aging.
Well, good morning. The Harris County Area Agency on Aging is a city-county partnership. We are located within the Houston Health Department. We have been around since 1965 through the Older Americans Act. We provide services for seniors who are 60 years and older who reside in Harris County/Houston. And those services include our nutrition program, our in-home services, our benefits counseling, information referral and assistance, as well as evidence-based programming.
Dr. Botsford, tell us briefly about your agency, and also what are you telling your patients during this pandemic?
Good morning, yeah. I'm with Iora Primary Care. We are a new kind of primary care doctor's office geared towards older adults on Medicare. We have 6 primary care offices around Houston on the northwest and southwest side of town. And we focus on building relationships with patients, spending more time, and using a team-based care approach to really be able to outreach to patients when they're not just in the office. Mm-hmm. In COVID-19, things have changed for us like they have for many people. So we're doing phone and video visits for our patients as much as we can, although we can see patients in the office when that's needed. I think the big different thing we're doing is we're trying to be active about outreaching to patients even when they're not calling us. So trying to make sure our patients are prepared for the weeks and months ahead.
So Paula, have the Area Agency on Aging changed their service delivery model during this pandemic?
We have. We have our normal home delivery meals that we provide, but now our congregate, because we want to make sure that our seniors stay safe, that they stay home and stay safe, we are now delivering those meals to them in their homes. And so that's been a great change for us. We are also doing our information referral and assistance. Our call center remains open and ready to receive all calls from seniors to assist them. We have reached out to over 30,000 seniors in our database to let them know that we are here, that we are available for them. We are working with the health department and providing transportation to those seniors who need travel to the testing sites, as well as providing masks to our seniors, and we will continue to do that until our supply runs out.
So what are the two of you doing in respect to dealing with seniors who are socially isolated?
So I'll go ahead. What we've done, we've set up what is called a conference line for our seniors, and we do that about every 2 weeks. where we're actually doing conferences and allowing the seniors to call in, and they are loving it. They are sharing with us what they're doing, but it's also allowing us to understand what their needs are and to be able to address some of those needs. We are also doing telephone reassurance, and so all of our providers are connecting with their seniors at least twice a week to make sure that they're safe and to also address any needs that they may have.
You said your providers, what is that?
Those are providers that we contract with, our nutrition providers specifically, such as our congregate. We have Baker Ripley, we have the YWCA, Interfaith Ministries, the City of Jacinto, some of our other municipalities that also provide meals, Northwest Assistance Ministries, as well as some of our other providers.
So
1 minute, Dr. Boston.
Outreach is a big part of what we're trying to do as well. We find that many of our patients aren't reaching out to us because they're scared. They're staying at home. But what we want people to do is reach out. We don't want them to confuse social distancing with social isolation. So we want people to still interact. That human connection is more important now than ever. So we're reaching out to our patients to let them know we want them to call us when they have issues. We're also reaching out to provide resources for ways that people can stay engaged, whether that be through online exercise programs or virtual groups, to stay connected to one another and try to stay healthy.
Stay tuned for our second part of our COVID-19 update, focusing on seniors. We'll be right back.
What is the 2020 census? Every 10 years, the census records everyone living in this country. It's written in the Constitution and comes in a questionnaire that counts everyone who lives at your address on April 1st. The data can be used to inform funding for services like fire stations, schools, clinics, and representation that affect your community. Shape your future. Start here. Visit 2020census.gov.
Mr. Williams?
Okay, welcome back to our COVID-19 update. And we have with us Dr. Bostic from primary care physician from Iora Primary Care, and Paula Johnson, the Bureau Chief for Harris County Area Agency on Aging. Dr. Bostic, what are you telling your patients?
So, of course, the message we're trying to send at Iora is stay home when you can.
Okay.
But I think the bigger message is that there's more for many of our older adults to worry about than coronavirus right now. And we don't want them to overlook their chronic conditions. So 80% of our seniors have at least one chronic condition, and 2/3 have two or more. And it's easy to forget about taking care of yourself when there's so much stress and anxiety about other things. So we're encouraging our patients to be sure to remember to stay active, get exercise, keep walking. Just because you have to stay away from other people doesn't mean you can't still be active. Don't smoke. Shouldn't be doing that anyway, but especially with coronavirus, it puts you more likely to have bad outcomes if you smoke. Keep connected. So again, isolation doesn't have to mean that you can't stay connected to family and friends. And then the final thing is to think about being more active in monitoring your conditions. So if you have a blood pressure cuff and you have high blood pressure, keep an eye on that more regularly. Same thing goes with blood sugar. Check your blood sugars if you're someone with diabetes. If you have heart failure, think about stepping on the scale and monitoring your weight. So those are things that you can do to make sure that in the midst of all the coronavirus anxiety, we don't forget about the other things that are big contributors to health.
So really we should stay the course and keep an eye on our health.
That's right. And if things go off track, reach out to your doctor. We would much rather hear about it early than hear that you had to end up going to an emergency room. So especially with Iora, please call us. We are happy to talk about things that are not COVID-19 as well.
So Paula, you said that y'all are calling your clients on a routine basis. What are you hearing from them?
Well, we're hearing things. An example is a couple of our seniors, while we are delivering meals to them, they're also worried about their pets. And so we have had an opportunity to receive a grant that's going to allow us to purchase food for the pets, so our seniors don't have to worry about that. We are also, as Dr. Botsford said, we're also looking at doing continuing evidence-based programming with our seniors.
What does that mean?
Evidence-based programming such as diabetes self-management, chronic disease self-management. We are able to use different virtual platforms to still connect with our seniors and to still keep them engaged in doing those other exercises, or Tai Chi. Those are things that we can still do with them.
Suppose they don't have the technology.
We are also looking at other ways, and that's where those conference calls come in, but we can talk to them as well. And we're also looking even at with mental health, where one of our providers is using telehealth to still connect and to make sure that our seniors are still feeling safe and not feeling isolated.
You know, there's been a lot of press conferences. You can't turn on the news without hearing something about COVID-19, coronavirus, whatever. What's your general advice to seniors with that overload?
Yeah, at Iora we tell patients that it's good to stay up on news, but don't want to overdo it. So keeping a regular routine, keeping a schedule of activities, turning off the TV from time to time, staying active, and when that anxiety starts to build up, using strategies like breathing exercises and meditation can be good ways to refocus away from the stress and anxiety that coronavirus causes and make sure that you stay balanced at home. I think the other part of that is identify and reach out to your support network. Make sure you have a family or friend that you can call if you do get scared or something's going on. These may be people who can help you out with technology or help you to connect to your doctor's office as well.
Should we be doing more to reach out to seniors?
I believe so. One of the things, as Dr. Botsford said, that we're also doing is we have developed a handout for our seniors to be able to, for those, as you mentioned earlier, what do you do with those who don't have the technology? To help them to navigate some of the platforms, the social networking platforms that are out there, to stay connected to their families and to reach out to others and to step away from the television, step away and look at some other things that some of their other activities that they enjoy and stay connected.
I just got a note that said the governor of New York extended stay-at-home order for 2 more weeks. So knowing that it's a possibility that that might happen with us, does it change anything?
I think we would say stay the course. Take it 1 week at a time. It's easy to feel overwhelmed when we think about this as disrupting our lives forever. So 1 week at a time, keep that schedule, keep that routine, find those outlets that provide stress relief, and reach out to your doctor if it feels like it's too much.
Okay, is there a number we could call for?
Yes, for the Harris County Area Agency on Aging, please call 832-393-4301. And our information referral and assistance specialist or aging specialist will connect them to the services or answer those requests that our seniors will need.
Okay, I want to thank you for joining us for our COVID-19 update. Expressing gratitude to the Rotary Club of Houston President Kathy Fenninger. I am Stephen Williams, the Director of the Houston Health Department. We'll be with you next week to give you another update with our 2 public health docs, and who knows who else might join us.